Majority of Kenyans flocking here to seek free health services paints a complete picture of the dire health situation in the country.
Sasa kwa sababu kwa hospitali hatuna madawa na shughuli zingine kadhalika.
At Ruri grounds in Murang'a County, during a free medical camp, many Kenyans expressed that accessing medical services in public hospitals feels like a distant dream due to the expensive costs they incur.
We had anticipated about 300 to 500 people to come, but so far we've registered over 1,000 people, meaning that there is real and dire need for health, the engagement with the people here on the ground.
They feel it is better to die at home than to struggle in seeking for health services. Kidney patients bearing the brunt. Irungu Nyakera, founder of Irungu Nyakera Foundation, however, encouraged Kenyans that the new medical insurance cover, SHA, should provide treatment for all.
Really, if somebody is sick, there is absolutely nothing else they can do. They cannot get up and go to work. They cannot feed their family. They can do nothing. So if we prioritize health, we will actually be able to cure a lot of other issues within the society.
Meanwhile, religious organizations want the government to explain how it will pay the 2 billion shillings debt owed to health institutions after the transition from NHIF to SHA.
We are wondering now, as we move from NHIF to SHA, what about the debt that is amounting to about 2 billion to all the faith-based facilities in Kenya? Are we going to be paid before we move, or even when we move, are they going to continue paying?
Bishop Joseph Obanyi of the Catholic Diocese of Kakamega says if this debt is not paid, then it risks paralyzing operation of church-owned health institutions.
Whoever is in charge of the SHIF was not very well prepared to change it over in a smooth way, a smooth transition. And then Kenyans are complaining around, and they even think that the SHIF is not the right way to go. But that's not the real point. The point is they needed to strengthen this SHIF and make sure that it is serving the purpose of the Kenyans.
However, Health PS Harry Kimutai revealed that the government owes to facilitate previous NHIF cover that needs to be paid. He says within 90 days, all pending bills will have been cleared.
We've already secured 1.5 billion Kenya shillings to start dispersing to all the healthcare facilities. We've done this because we needed transparency in the whole process. Because previously, some facilities were receiving payments, some were not. What we know that NHIF owes in terms of all the facilities is roughly about 30 billion. So the faith-based, we do not know exactly how much, and that's why we have a committee. The private, we do not know how much it is. I know the counties had given us their figure of about between 8 to 12 billion.
Electin Odira, K24 TV.